You're listening to The Voice of Russia in London with me, Juliet Spare. Cases of witchcraft-related child abuse in the United Kingdom are rising. In the past 10 years, there have been 83 reported cases of child abuse related to faith or suspicion of witchcraft involvement or demon possession. 4 of these cases ended in the deaths of the children. Now, the British government has announced plans to introduce new training for social workers, teachers, police and church members to try to combat the abuse. In 2001, the torso of a young African boy was discovered in the River Thames. The torso was found as it floated past the Tower of London towards Tower Bridge in central London. And it was found to be the torso of a young black child. The police named the body Adam in the absence of any positive identification. But in Adam's case, a key witness left the UK before being called to give evidence. While this then led to no conviction for Adam's murder, it led to Scotland Yard uncovering a child trafficking ring on children from Africa being brought to the UK for ritualistic practices. Joining me in the studio to discuss witchcraft, what it is and what can be done to stop it in relation to child abuse is Dr. Richard Hoskins, an African studies expert and the author of The Boy in the River. Chief Executive of Church's Child Protection Advisory Service, Simon Bass, and John Azah, Director of Kingston Race and Equalities Council, and Dr. Moto, who joins us on the phone from South Africa, who's a professional African healer. My first question, and I think I'll ask you first, John Azah, if we pinpoint the case of Adam in 2001, who the Metropolitan Police said was the first case of a British ritualistic killing. How prevalent is witchcraft-related child abuse in the UK?
Well, the simple answer to that question is we don't know. We've had a number of cases which have come up. In my view, Adam was the first recorded case of what we've come to know now as ritual killing. And therefore, perhaps the work is still ongoing, even though there have been a number of identified cases. We are still not clear how many of these cases are taking place. And I think we see part of our jobs, one, to work with those communities to make them come forward to report cases, but fundamentally to also educate those people who feel that this is a way of addressing some of those arcane issues within those communities. And that's why I asked the question, how controversial it can be in this country to point the finger at swathes of communities who are practicing these rituals, when in fact the majority of people within this country are very law-abiding, do what they are needed to do, and a minority are perhaps in the grip of some of these witch doctors and faith healers who then get to influence them to behave in what are unacceptable ways.
How groundbreaking was it, this case of the torso in the Thames in 2001?
Adam's case was totally mind-blowing. I don't think there was anybody, certainly in my view, in this country who could have imagined that, you would find a torso in the River Thames, and that torso would belong to a 6-year-old boy, and that boy would have been murdered as a result of a ritual, either to enrich somebody or to enrich communities and so on and so forth. So it was groundbreaking in that sense. As we went along to investigate those crimes, we found that there were practices which were totally unacceptable in the West to some of us, and my initial response was that these communities who were practicing these very terrible crimes should be brought to book. But as we did the work, I found to my cost that there were also levels of ignorance within certain communities who those people, rather than just being prosecuted, needed to be educated, because some of those people brought cultures and traditions from their mother countries where they didn't know any different. And obviously, if you came to this country hoping to be a qualified doctor, make lots of money, and suddenly you found yourself to be a cleaner and a faith healer, a priest who has a lot of power within those communities comes along and says to you, well, actually, maybe it's because of your child who is possessed, or I can say prayers for you to cure that child who, because of their behavior, either autistic or whatever, which are not diagnoses which are prevalent in certain countries, then they are victims of those faith leaders who then prey on their vulnerabilities. So there are things that we need to do in conjunction with training the professionals, and I'm not sure whether the minister is aware where to start from. It's a good deal to offer the training, but I think we need to do some primary work with communities and social workers and doctors and other professionals before we get to the actual training.
I'd like to come to you, Dr. Moto in South Africa, please. John Azah just referred to the healers within communities, that parents who may be feeling that they have suffered some injustice, and that might be because their child is possessed or a relative is possessed, and they might go to a healer. Now, you had practices in London. How often were you called upon, and what did you do for members of your community?
Okay, like in our African tradition, it has been like running ever since, passed by our like forefathers from those early years. Everybody has a different perception, like as in towards witchcraft, and like us, we also face same different kind of like odds by day, like we find like children have been killed or their parts have been cut off for certain rituals and ceremonies. But like as healers, we are also trying to fight against that. So it's all over the world that these things are happening. Even like I had a case in Czech Republic.
What's the difference, though, between witchcraft and healing?
Okay, the difference between witchcraft here, the way we take it, because in witchcraft we see people are using dark forces. They cast spells, they use a lot of black magic, they use white magic, very different kind of things. And with healing, we use traditional medicine as to help people. In fact, we help people who have been attacked with these dark forces.
Mr. Azah obviously mentioned then that the government, if they really want to tackle this, need to start at the very beginning and utilise the community, social services, teachers, and find out what they can do. Now, you're the Chief Executive of Church's Child Protection Advisory Service, Simon Bass. What role do you have in preventing witchcraft and child abuse?
We are a national charity, and we're working with faith organisations to address safeguarding child protection, and that includes working very much with BME communities, with African churches, and we have been doing so for a number of years. This week, you mentioned Tim Loughton and his statements. That's about a national action plan to address this. But the action plan isn't the start, but is a combination of work that has been undertaken for the past 10 years. In terms of, yes, Adam is very significant, as was the death of Victoria Colombier, and we have seen a marked difference in terms of the statutory agency's response because of the death of Victoria in addressing safeguarding within faith communities, and Victoria died over 10 years ago, and we've been working with many organisations. We're on the working group for the National Action Plan. We've worked with Victoria Colombier Foundation, Afruka, the Congolese Family Centre, and the statutory agencies in addressing safeguarding. But where I would agree, what needs to happen is that each and every local authority needs to look at what faith organisations, what faith groups, churches, places of worship they actually have on the ground, and make links with them. Because although there's been mention of 80 to 83 cases that are known, they are actually cases that the Metropolitan Police have identified, and that is purely because the Met Police have responded and are recording. We do not know elsewhere in the country how many cases, and that's why it is so unreported. And although there has been a lot of work, and over the past 5 5 years, we've trained over 4,000 faith leaders in safeguarding and addressing many of the issues that have been raised. What is needed is for each local authority and their local safeguarding children's boards to actually know what faith organisations there are and link with them, because of course churches are not the problem. Yes, there are some rogue pastors, but many churches are actually providing a great deal of good work, and they are, outside of schools, the largest providers of children's work. It therefore should be that every local authority takes notice of the faith communities that they have.
Now, I'd like you, Dr. Richard Hoskins, an African studies expert, criminologist and author of the Boy in the River book, provide us with some sort of analysis.
Well, I want to concur with something that John Azah said earlier, that it's not right to paint entire communities as if they're all practising this deviant form of any religious tradition. And I think I can tie that in also with what Dr. Moto said, which is that his aim is to heal people. And certainly that's my experience of studying African traditional religions, that by and large the majority of healers, whilst sometimes being called witch doctors, are actually generally benign. They want to heal people. That's what their aim is. It's not to cast black magic on people, to use his own phrase. However, there are, of course, deviant people in all religious traditions. It doesn't just apply to African traditional religions or indeed African new churches. It applies to every single religious tradition in the world. There are deviant people. We know that from 9/11 onwards. And going back, and indeed in Western Europe, there's been some of the worst atrocities committed in the human race by people, sometimes in the name of religion. There is, however, a major issue here. My big bugbear with the report, whilst there's been superb work that's gone into it, clearly, and a lot of work has gone into it, and the working group met, I think, something like 8 times. There's some really good stuff in it, but the biggest problem I have with it is that it says quite clearly at the beginning and then later on in the report that we are not here to criticise or indeed to analyse faith and belief. The problem with this is that there is, in some cases, a systematic issue linking some faith beliefs to abuse. If you travel as I have and studied and researched in parts of Africa, there is a massive problem here. There are children who are being abused in the name of religion on a large systematic scale. There are pastors preaching regularly in parts of Africa that your child can be possessed by an evil spirit. Therefore, it's no surprise that it's found its way into Europe. It's not rocket science. Of course it has. And there are pastors here who are preaching the same thing. And if you continue to avoid, I think, the issue that actually there's a link to faith here, you're missing the elephant in the room, the bigger picture. And I'm afraid, although it's difficult, and it is difficult, it's difficult to address this for some communities, it's difficult for white liberals who don't want to be seen to touch the multicultural agenda. If you go into this area, you have to, in order to stop children being abused, and we have to touch on that sacred cow, if you like, which is actually, it is linked to faith.
Mr. Azah,
I think Richard is absolutely right. I mean, my problem with the way the government is managing this really unacceptable behaviors within certain communities is it gives the impression that the government also, because it's so sensitive to response from communities. I mean, forget ritual killings. Go to FGM, go to any of these things which affect black and minority communities. Governments regularly are very sensitive to what the leaders within those communities want to do, and therefore ignore the response from the grassroots. And I think if we're going to tackle this, we're going to have to be very bold about encouraging people to come forward. You know, you have to treat swathes of communities, as adults, and not treat them as if, you need to handle them with kid gloves. And because the government don't want to touch faith communities, because this is embedded in faith communities, then you would find people dancing around the edges. We want to work with the churches, and I don't think we need to blame the churches as such. We want to work with the church communities, the faith communities, to say there's a problem. And until we accept that there is a problem, be they minority communities, then we will continue to dance around the issue. And that's the task I want government to handle. A few years ago, we did some work with the Department of Education. There was a report was done, consulted widely on it. When the final report came out, that report was watered down so much that you could have written that report without actually doing any research. And that being the essence of how governments have behaved. And therefore, I welcome anything which wants to tackle these ritual killings robustly. But there's a fundamental grassroots work which needs to be done to encourage communities to come forward. If not, it will continue to remain in the margins.
You're listening to The Voice of Russia with me, Juliet Spare, and we're discussing witchcraft-related child abuse. Joining me in the studio is Dr. Richard Hoskins, an African studies expert and author of The Boy in the River. John Azah, Director of Kingston Race and Equalities Council. Dr. Moto is on the phone from South Africa, and he's an African healer, and Chief Executive of Church's Child Protection Advisory Service, Simon Bass. What strikes me is this is over a decade worth of research and resources that the police, academics and church groups have had. Surely the government can come up with something. Simon Bass.
Well, they have done, and there is the action plan, and in terms of it is linked to faith. That's what it says. Child abuse linked to faith or belief, and it's getting that balance, isn't it? Because John started and Richard agreed in terms of this is not to label all faith. There are, and the term is often used, rogue pastors. Richard's correct. That the influence. I don't know of any scriptural reference anywhere that talks about the abuse of children, that it is right to do that, and that's across the faiths. But clearly a mixture of faith, cultural belief that has come over and is being used, and there are some rogue pastors who are abusing their positions of trust to harm children. And what we need to see, and the report suggests, is that in terms of engaging with communities, that we have those community champions, faith leaders who actually point out that better way.
John Azah.
But this needs to go beyond what I quote unquote call the academic exercise. When you look at how 20, 30 years ago the police service and governments and administrations dealt with rape, there was a progressive element which said, look, if somebody walks into a police station and says, look, I've been raped, the way it's dealt with now is different from how it was dealt with a few years ago. I think that's the kind of robust stance which gives people confidence that if you walk into any institution, if you walk into my organization and say, well, look, I'm a child, my parents are abusing me because they think I'm possessed, I ought to have a mechanism which allows me to work with somebody to take that child to a place of safety. At the moment, there isn't one, and therefore, if I run social services, the kind of semantics which takes place now within the academic sphere means that that child is perhaps ultimately sent back home to experience more of that abuse, and I think that's what is going to change. I appreciate what has been done, but we need to move it another level, because you're right. 10, 12 years ago, we found Adam. We did a lot of work. Acceptably, we identified certain things. But why is it that you can still go through places where there are less than 100 cases reported every year? And we know as activists that there are much, much, much more happening. I went undercover and I went to a consultation, and it took less than 2 minutes for this faith healer to decide that he wanted my £700 because I just gave him a story of my niece influencing my behavior because she'd just come back from Africa. Those things have got to stop. And unless we stop those things, we will continue to victimize the children, because this is about the children who are victims, really.
But it has gone beyond just an academic exercise. There is Working Together 2006 and 2010, and there's supplementary guidance there. In addition to that, there is a working action plan that is being rolled out, and that's not a starting point. That is a reflection of a lot of the work that's being done.
My problem with that it sounds good, and I've read the report quite carefully, and it does look good. It looks great on paper. You've got the columns and everything's tick-boxed, and without being too facetious about it, it looks like a great paper exercise. It's not at all clear how the funding is going to happen. I don't think actually the government have actually properly backed up the financial planning of how the action plan will actually roll out. And I want to come back to something that John said earlier, without wanting to agree with everything he says, but I find myself doing just that. There was a superb piece of research that was done that was not highfalutin academic work. It was very ground-based. It was based in communities. It was a pilot study that John was involved in. It was tremendous work. And it brought to light a lot of the issues that we're talking about here. And we're talking now, 6 years or so ago, and it was squashed. And that is because it was felt to be too hot to handle, but it was a superb piece of community-based research that should have seen the light of day and could have been rolled out right across London and indeed elsewhere in the country.
What was in there that was so hot to handle that we should know about?
John's in probably a better position to speak about it than me. But
the report basically said the things that I'm saying, that if you go to schools, if you go to faith leaders, if you go to community activists, and you go to some of the more proactive faith leaders, you will be able to identify, because of behavior and change behavior, how these things were affecting children. You work with social services to take that child away from the family.
Well, this report found, it found an incredible chasm between what was perceived to be UK law, child abuse categories of emotional, physical, sexual and neglect, and actually what communities themselves, people in communities, I don't want to say everyone in one community believes one thing, but people within communities thought themselves from their own beliefs and practices. And there was a massive gulf. And that is the kind of research that actually was incredibly valuable. And I don't necessarily want to criticise what's happened with the action plan or indeed reports of people like Eleanor Stobart, but I do praise the kind of ground-based work that was done in that research that actually was tangible, it was based in communities, really came out of those communities, and which could have then really made a difference. Okay, practically what should we do? Well, I think pastors all by obligation should be required to go through child protection training, not simply on a voluntary basis. I mean, if you look at schools, there is no way whatsoever that we would allow to take place in churches in schools what takes place in some churches. I mean, it is extraordinary. And it's no good saying that it's all fine out there. It is not. There are pastors routinely, for example, having one-to-one sessions with children, breaking every single basic child protection procedure going. I know of social service workers. I've been on a case lately. I'll be very careful what I say here. But a case where a social service worker took a child who had brought up an accusation of witchcraft, placed that child back with the pastor, who was the one that was instigating the issue, who then phoned around all the family to put pressure on the child to withdraw the evidence. Had that child not been robust, we would never have seen that case coming to court. That's a fresh case. These are the kind of issues I'm afraid that we must have obligatory child protection in place for all pastors, and I think there needs to be a register of that. I do praise what's going on. I think the work that Simon and the others are doing in this area is fantastic, and actually we have come a long way in 10, 12 years with the churches, but it needs to be driven by central government. I mean, it really does, not just left to local authorities.
Dr. Moto, I do not understand faith healing. What I do understand in London is that there are a number of people who we've challenged about some of the healing practices that they've exercised on children, and they haven't been able to assure us. Now, you may not be one of them, and what I want to do is, since you are an international healer, the next time you're in London, it would be useful to try and get together to look at some of the things that you're doing, because we want to work together with people who are legitimately practicing something which traditionally was handed down from our ancestors. I come from Ghana in West Africa myself, so I do appreciate some of those powers, but it's the behavior of some of the minority in London which is just not acceptable. So I don't know whether you are prepared to take up that offer so that we can try and learn something from you, and we might be able to give you some of the concerns that we have.
Yes, I'm willing to be able to work hand in hand with you. Actually, like here in South Africa, we are so much being recognized, and like the government has tried to help us, even because like in our research we've been able to get medicine, traditional medicine, which has helped people all over with different kind of diseases and everything. And like we've been trying to see how we can help children as well. Because it's not like us healers are a target for kids in order to do certain rituals, but that thing has been happening all over. Like kids have been sort of like, if they manipulate or take away their private parts, people will be able to get rich quickly. They'll be able to have a lot of finances, finish their problems.
You're listening to The Voice of Russia with me, Juliet Spare, and we're discussing witchcraft-related child abuse. Joining me in the studio is John Azah, Director of Kingston Race Equalities Council, Chief Executive of Church's Child Protection Advisory Service, Simon Bass, and on the telephone from South Africa, a healer, Dr. Moto, and Dr. Richard Hoskins, an African studies expert and author of The Boy in the River. Simon Bass.
I've got to say something about what Richard said. There is a Safeguarding Children's Rights document the Trust for London did, which actually addresses some of the things that Richard talked about in terms of response following training, in terms of going into churches. I do totally agree with Richard in terms of the issue of funding, of course, because although the government have facilitated the report, there is not the funding there to back that up. And I know that a number of those on the working group would echo what I'm saying in terms of that. We live in tough times and there is not the money forthcoming. But what needs to happen, as you've said there, is increased training in faith communities, but also in terms of practitioners, social workers, doctors and others need to have an understanding of this issue and many of the other issues that are linked to trafficking, etc., so that they can better respond, so that they can hear the voice of the child.
Dr. Richard Hoskins.
Let's grip the issue in the way that John Azah mentioned before. I think we need the kind of ground-based research rolled out, which would make a massive difference. I think that it's not actually that expensive to do that, and it needs to be done because it's community-based research, and I think that would be incredibly valuable. Let's make it obligatory for all pastors and churches, obligatory to register with child protection and to be inspected regularly, just as you are in schools by Ofsted. I think that's incredibly important. And let's just generally grip the issue by funding it. It's no good but rolling out an action plan and then providing no money for it. It has to be funded. If the government is serious, let's not wait for another Christy Bamu case or Child B or Victoria Columbier or Adam for that to be back on the agenda. It needs funding now so that we stop and prevent any further cases.
John Azah.
Well, I mean, I think, I'm evidence of what activism does. But if you look around the country, most of the organizations which represent what I do, the activists on the front line, race equality councils have disappeared. And therefore, it's not about just funding, but it's recognizing that body which sits between the authorities and the victims. So we need to identify agencies locally which are going to work and offer the training with churches, so that social worker, that teacher, that victim has somebody in the middle who they can go to, because without that, any amount of action planning, any amount of funding is not going to resolve the issue. And also to give part of the power to the children, because those are the things that we need to do.
I'd like to thank all my guests, Dr. Richard Hoskins, African Studies expert, Simon Bass, Chief Executive of Church's Child Protection Advisory Service, John Azah, the Director of Kingston Race and Equalities Council, and Dr. Moto on the phone from South Africa, an international African healer.